All right, go for it.
Thank you everyone for joining today's webinar, Radon Wellness Holistic Support for Conventional Treatment. My name is Tammy Carter. I am a member of the Associate Board for Susan G. Komen, Chicago. Komen Chicago's mission is to save lives by meeting the most critical needs in our communities and investing in breakthrough research to prevent and cure breast cancer. Today, I am so excited to introduce our guest speaker, Dr. Michelle Smekens. Dr. Smekens understands that integrative medicine should work for real people living in the real world. She specializes in women's health and oncology, often working in tandem with traditional oncologists for the length of a patient's journey. From active cancer to survivorship to prevention, she especially enjoys helping children and families, providing naturopathic remedies to support and lessen the side effects of conventional therapies such as chemotherapy. Please welcome Dr. Michelle Smekens.
Hi, thank you so much. So I have a lot of material in tonight's lecture, so quite a few slides, and they're a little bit dense, so we're going to cover a lot of ground, but we also have a little bit of time at the end for questions if anybody has any questions. So if anything comes up and you think of it, just hold it to the end and we will address those. Okay, so here's a little overview of what we're going to talk about tonight. First of all, a lot of people have not seen an integrative practitioner, particularly related to their cancer treatment. So I want to talk a little bit about as an overview about what integrative oncology is and what it is not. And then I'm going to dive into the breast cancer support, first talking about surgery, then talking about hormonal therapy. Specifically, we're going to take a look at hot flashes and bone health, as those are common side effects of endocrine therapy. Then we'll touch on chemotherapy and specifically highlight fatigue, since this is a very common symptom and there's not a lot of great conventional answers for that. And then lastly, I will discuss immune support specific to breast health, but also kind of general immune support as well. A little bit of overlap there too. Okay, first a little disclaimer. You'll notice in this presentation that there are not specific doses given of different nutraceuticals or foods. And the reason for that being is that this is a general lecture meant for kind of information and learning. And it's not a specific prescription or recommendation. We really want you to go back to your providers to get those kinds of recommendations made so that they're individualized to each person, because people can have different comorbidities. Some person might have diabetes. Another person could have heart disease. Also, in this kind of a lecture format, you never know what medications people are taking, and it's very important to know because there can be a lot of issues with drug-nutrient interactions if you're not aware of everything that people are taking. So kind of the second bullet point just goes on that. If you have any questions, reach out to your healthcare provider so that they can better follow up with that. Also, at the end of the presentation, I have my contact information if there are questions that you think of in the future as well. Okay, so first off, what is integrative oncology? Okay, so I am a naturopathic physician. A lot of people might not have seen a naturopathic physician. In my field, it's a standalone profession. So after you go to college, it's a 4-year, year-round medical school where you have your typical coursework in anatomy and physiology. You do take a lot of classes in pharmacy, and then there's extra classes, things like midwifery, botanical medicine, extra hours and credits in nutrition, so that you have kind of like augment your education with a lot of natural medicine coursework as well. After you complete your education, you sit for your series of boards to attain a license, and then you can go on to do some specialization. So you can take a residency, you can get board certified in different areas. And for myself, I got special certifications in nutrition and also in oncology. So I did a 2-year integrative oncology residency to get a little bit more specialized in the field of natural medicine specific to cancer care. So here are some kind of basic philosophies of naturopathic medicine. And I just want to highlight a few things here. I really believe in docere, which is doctor as teacher. So when I work with my patients, a mainstay is transfer of knowledge. I want people to understand what it is that I know about a particular situation that has arisen. And tonight we'll talk about some of those. And then together, I want to make joint decision making. So it's not me just saying, you must do this, or you must eat that, or not eat that. A lot of the work that I do, I really believe falls in the realm of kind of education and helping people understand a little bit better the disease process and the side effects that they're experiencing. I also believe really much in prevention. So I'll see a patient sometimes who will have a BRCA mutation, and I'll talk a lot about what we do and we don't know in terms of breast cancer prevention if someone's a carrier of that genetic mutation. Also, in terms of prevention, I'll talk about different modalities that could have long-term side effects. So, say for example, someone's having certain types of left-sided chest wall radiation that can sometimes cause some impact on the heart. So I'll talk a lot about cardiovascular health and how for the longevity and survivorship, you can support your heart health. So I really focus on prevention a lot in the work I do with patients. And then I want to kind of highlight, and I'll talk about this a little bit in a future slide, which is first do no harm. Natural medicine can be powerful, but that doesn't mean it's innocuous. So just because something's natural doesn't mean that it couldn't have an adverse effect. For example, if you think about it, really mercury is natural because it occurs in the Earth's crust, and it is, it is technically a mineral. So you have to be careful about thinking that all things natural necessarily mean it's safe. It doesn't always. That's not always the case, and we always have to be considerate of that. We can utilize natural medicine, and of course, that's my passion. But be conscious and cognizant of some potential pitfalls as well. Um, Specifically, integrative medicine is different than alternative medicine. So I will sometimes have like a prospective patient come to me and they say, I don't really feel like doing chemotherapy, or I really don't feel like having surgery for my breast tumor. And like that really is not like an appropriate recommendation for most people, depending on what's going on in their situation. Almost all the time, they need to have some conventional therapies. And I spend a lot of my time really counseling people. There's anxieties and different reasons that people have for being fearful of going forward with conventional therapies, and I really dedicate myself to working with people and helping them calm those fears so that they have best possible outcomes with the decisions that they have to make. There are some situations, for example, like smoldering multiple myeloma or some very early CLL leukemia types, sometimes very, very early prostate cancers where there'll be like a watch and wait period and there's not a conventional therapy on board. And then those situations, I would absolutely do still work with patients. But for the most part, in the breast world, working with me, integrative medicine is not alternative medicine. They're using conventional therapies as well. Okay, and so I just want to highlight too on here that as practitioners, we have to be compassionate to our patients, and then we absolutely should have a collaborative nature. So when I'm working with patients, I'm talking to the oncologist, and I'm talking to nurse practitioners and primary care doctors. So it really integrative medicine has a collaborative feeling to it. It's not like a us versus them or like an ideology competition. It really has a collaborative nature to it. So that's kind of also something to differentiate a little bit here in this lecture. And then I want to get specific to breast oncology, since this is my focus. 80% of my patients are breast cancer, active treatment or survivorship. And specifically, what I'm working with when I'm seeing these breast cancer patients is understanding how do these phytonutrients found in plants and vitamins and minerals, like how can they potentially impact the body in beneficial ways? And can we do these things through food? Do we need to do these things through supplements? I make treatment plans for patients. I individualize it to whatever stage they're at in terms of their treatment. So what you'll see going into surgery as far as recommendations from me might be very different in terms of recommendations for chemotherapy, and the dietary advice as well can really sway depending on what the treatment is at hand. So let's first talk about surgical support a little bit. I like to get my patients sleeping well after surgery. So sometimes after surgery, people have drains in place. Sometimes they have tissue expanders if they're going to end up getting breast implants, and sometimes those are uncomfortable. So in the post-operative period, sleep is really crucial in breast cancer. So I do utilize melatonin. Here's a trial. If you look at this, that women who took the melatonin, in this case, in this situation, they did give a dose on the trial, experienced less depression. Even, and these were women that they looked at who did not have any signs of depression going to surgery. So these were not people that they thought were predisposed to depression, but I really think the quality of sleep and the anti-anxiety impact of melatonin for a lot of people help them to recover after breast surgery. So if I have a patient that I think that this might be a concern, or the type of surgery that they're having is really hard to recover from and they're not sleeping well, and actually, I work a lot with the breast surgeons too, and they'll give me a heads up. They'll shoot me an email or leave me a voicemail and say, "Oh, so and so, had a deep flap, which is a big surgery, and they're not sleeping well. Can you please help them out a little bit?" And so, absolutely, melatonin is like kind of at the top of my list. Firstly, because of these kind of studies showing it's effective, but secondly, because melatonin has its own unique benefits in terms of immune system support, helping with bone marrow recovery. There's some really cool studies looking at melatonin as actually preventative in terms of reducing risk. So I do utilize melatonin a lot in the kind of the perioperative period around surgery. And then I wanted to mention a homeopathic medicine called Arnica montana. So homeopathic medicines are super small amounts of naturally occurring agents. And in this trial, they gave Arnica montana in kind of like a higher dose, just for a short period of time, like really like less than a week. And what they found was that the women who had it compared to the placebo ended up getting less seroma. And for those of us who work in breast oncology, we know that seroma can be like a really undesirable side effect because you get a pocket of blood or fluid. It can be painful. Sometimes you have to go back to surgery and evacuate it. It can sometimes affect the aesthetic outcome of a surgery if we're talking about reconstruction. So a lot of times I'm using Arnica montana because it's super inexpensive, very safe, doesn't have drug interactions, as a prophylaxis for helping reduce risk of seroma. So I use Arnica really quite often. Okay, so we talked a little bit about some of the surgery. So I want to talk a little bit about hormonal therapy too, hot flashes and bone health. Okay. Um, so for hot flashes, here's a slide that just talks a little bit about omega-3 fatty acids. So there have been numerous trials, and this is just, I first put 3 trials up here, but there have been a lot of trials that have shown that intake of omega-3 can reduce hot flashes. And I found this to be very interesting. If you look at the second trial that's listed, they call it the LOVE trial, the lacto-ovo-vegetarian. So those people could eat dairy and eggs, but when they supplemented them with omega-3 compared to supplementing them with extra virgin olive oil, and I love extra virgin olive oil too for a lot of health reasons, but they actually saw less hot flashes in the group that got the omega-3. So it wasn't really just about diet quality, because in both of these studies, in both groups, arms of this study, they had women eating lots of fruits and veggies and eating a healthy diet, but the group that got the omega-3 did much better in terms of hot flash management. And I want to point out that vitamin E is a very popular hot flash intervention too. And the studies on it are mixed. Most of them are positive. So most show vitamin E does reduce hot flashes. It does it to kind of somewhat of like a little bit of a smaller extent. But then this more recent trial combined omega-3 with vitamin E and said, hey, together, these things had a synergistic effect on hot flashes. So potentially that is a treatment if you're not getting a response from just taking one or the other, to combine them together and maybe see an improvement in the hot flashes as well. Okay. One thing I want to mention too with the omega-3 and just in general with hot flashes, that some of the interventions for hot flashes take a little bit longer to work than with some other symptoms. So I tell patients, stick with it. Like, you don't quit it like 2 weeks in, because we can't really make a good assessment about whether the treatment was effective, because it's a little too soon to say whether the hot flashes improved, because they're a little bit slower to respond. So that's kind of one of the takeaways I want to give you so far with hot flashes is, don't be too quick to change therapies, because sometimes you start getting peak benefits like 4 weeks in, 6 weeks in, depending on the intervention. So I just want to talk a little bit too. We mentioned a little about surgery, but we want to talk a little bit too about like surgical nutrition support because it used to be that we would tell patients like don't eat anything after midnight. So say you're having surgery the next day at 9 a.m. The rule was eat nothing. You only get to drink water. So you go into surgery in a complete fasting state. Well, in like the last 5 or 10 years, there's something called ERAS, which is like improving surgical outcomes. So kind of across the country, people are looking at ways, how do we optimize surgery, like what steps work, what steps don't have as much effect, and how can we improve surgical outcomes. And one of the ways to do that is by having people not fast, actually. So they come up with some of these drinks that are very quickly absorbed, so they're not sitting liquid. Because the issue with fasting before surgery was that they didn't want you to have fluid in your stomach in the case that you'd have to go to the operating room and end up having really quick general anesthesia and then they had to put an airway in. They didn't want anyone aspirating. So the whole issue with fasting before a surgery was an aspiration risk. So they've come up with these drinks that are very quickly absorbed because of their osmolarity and the pH of them. They're very quickly absorbed. And specifically what they are is they're like these like kind of like slow burning carbohydrate containing drinks. And when they compare them, these high complex carb drinks, they find less surgical complications. It's actually pretty awesome because these are super inexpensive. Like two of them is like $10, $12. And what the research shows is that people who do this and don't go into surgery fasting have less anxiety, they stay in the hospital less, they have less infection, less nausea, they overall report less distress. I gave an example, and again, I have no affiliation with any brand of anything, but I have an example of one of the most popular brands, which is Clear Fast, about 200 calories. You drink one about midnight, the night before surgery, and then another one 2 to 3 hours before surgery, like in the morning. And basically, maltodextrin is one of those kind of slow burning complex carbs, but then they also put some nutrients in there, right? So they put citrulline in there, which helps with like blood vessel and kind of vascular flow. Zinc, which we'll talk about later, which helps with collagen cross-linking, vitamin A, which helps with epithelial cells, selenium, which is really important for immune system function. So they kind of adds malic acid for energy, stevia, which is like a no sugar natural sweetener. So I just want to point out that this kind of trend in thinking about surgery is really shifting away from doing these fasting. And if your surgeon is not aware of this, like, please bring this research to their attention. It is definitely gaining popularity, but not everybody is aware of it. So I've definitely advocated for a number of my patients to do these kinds of drinks and not go into a surgery in a complete fast. After surgery, the kind of macronutrients, and macronutrients are like carbs, proteins, fats. After surgery, the macronutrients become really important. And then protein is essential because we really need protein to help with surgery recovery. So it's really important for the skin and the dermis and everything that's healing and the connective tissue repairs to have enough protein. So, of all the macronutrients after you had the surgery, I send patients home with kind of like protein goals. This is a time period where protein becomes really, really important, is in the post-operative period. There are some labs that you can check to make sure someone has adequate protein intake. So there's some things called prealbumin and albumin. So a lot of times I'm checking that on my patients and making sure their protein intake is enough before and after surgery. I also wanted to give some examples of omega-3 because we talked about omega-3 being helpful for the hot flashes. I do use supplements sometimes. People don't like to eat these foods, but I want to give examples of kind of food sources and how much omega-3. There's kind of branched out. So we have ALA and then EPA and DHA, and they have their kind of like unique different attributes in terms of breast oncology. But in general, for the hot flashes, all of those forms will be helpful. So it's not necessarily one over the other when we're talking about the hot flashes. I want to mention the herb black cohosh because it's one of the most popular botanicals to help with hot flashes. And in the last 2 years, we've had some really great papers come out. Climacteric is a big journal for menopause. It's like the go-to journal for menopause. And they did a meta-analysis in 2019 and 2020 and said black cohosh doesn't impact hormone levels, so it's safe for breast cancer patients. So they looked at a lot of studies and kind of combined them together and said it is absolutely safe. They didn't find any signs of liver toxicity, which was a concern. Going back 20 years, there were some kind of bad batches of grown black cohosh. They said no, like there haven't been any recent issues at all with that. And then I wanted to include a couple of studies, like a recent study in 2018 compared black cohosh to evening primrose oil, which is also popular for hot flashes. Both of them were effective, but black cohosh worked a little better. And I want to point out again, like I mentioned, that sometimes it takes a little time, you got to stick with it. And after 8 weeks, they started seeing the max benefit in terms of the hot flashes at the end of the 8 weeks. And I also want to mention that among all of this research, they found that you could also use black cohosh with these LHRH agonists, which is kind of like Zoladex and Lupron. So these are medications that are used for ovarian suppression. Sometimes they're used in premenopausal women to put them into menopause to kind of have a better treatment response. So also found to be safe with those medications, which is great news. Specifically, people always worry about tamoxifen because tamoxifen is a really fussy drug. And in general, I'm very conservative with tamoxifen with my patients and the kinds of either supplements or herbs or things they can use. The good news is there have been several studies that have shown that tamoxifen is safe concurrently. Those kind of studies look at who took tamoxifen with black cohosh and like what were their outcomes, like who had recurrence, who didn't have recurrence. All of those references are at the end of the talk. So if you are curious and you do want to learn a little bit more and look at the references, all of those are at the end of the talk and all the research is there. So if you want to look into any of it, which was good news because for a long time we didn't have those longitudinal studies looking at tamoxifen that actually found less recurrence among among tamoxifen black cohosh users. And we're not sure why, all the reasons that might be. Is it because people stuck with their treatment because they had less side effects, or is it that black cohosh in and of itself has some anti-tumor effects? So I'm not totally clear yet why it might be that there could be less recurrence, but there is some evidence to suggest that that is the case. Okay, so we're going to switch gears a little bit and we're going to talk about bone health. So these hormonal treatments that a lot of women are on from 5 to 10 years, sometimes even longer, they do affect bone density. So they can increase risk of osteopenia and osteoporosis, which is an issue. So the first thing, of course, I have my patients do is make sure they exercise because exercise is super important for bone density. And a lot of ladies will ask me, well, what kind of exercise? Well, having some weight bearing exercise does work a little better than not having the weight. So there have been some studies that have looked at kind of like water aerobics, which you think of as like not weight bearing. But I have patients who have knee issues or things like that going on. And so they like the water aerobics. It does help bone density a little bit. It just doesn't do it as well as the land based. So if I have someone in front of me and they're like, well, it's either the water based or nothing at all, the water based is better. I really pay attention also to the DEXA scan results. So sometimes you'll see in a patient where like the lumbar spine doesn't look so good, but the femur does. So then I'm like, okay, you're doing good with your squats and the legs look good you're doing your cycling, but we need to do better on the spine. So we need to start doing some core exercises. We're going to start doing some upper back, so I do individualize exercise recommendations based on kind of imaging and things that we get back as well. The most important nutrients I kind of listed here for bone, calcium, there's lots of different forms of calcium. And like the most common form you'll find on the market is like calcium oxide, which happens to be the least absorbed. It's still better than not having it. But I want to point out when people are kind of picking calcium that the ones that have the best bioavailability, and bioavailability means absorption, are calcium citrate and then MCHC, which is microcrystalline hydroxyapatite. So in general, when I'm looking at bone formulas for patients who aren't getting enough calcium through food and they need to take calcium, I'm looking for those types of forms to enhance absorption. I'm also checking vitamin D. I have a whole slide later on that. I have to look at my time, 6:25. But I check vitamin D in those patients. I make sure that they have adequate vitamin K in their diet. Green leafy vegetables. There are some situations people can't do vitamin K if they're on warfarin, which is less commonly used. And then we mentioned melatonin earlier, but there are actually some studies that show that melatonin users have better bone density than non-melatonin users too. Okay, so let's talk about chemotherapy, and fatigue is definitely really high up there. Most of my patients on chemo still continue to work, and a lot of them have children, they have other responsibilities, and they want to be able to live, their best life while they're going through treatment. And for sure, there's a time period immediately after chemo, or if someone's on oral chemo, it's kind of more of a daily basis where you'll have more intense fatigue, but there are some interventions that can be helpful. So this is kind of the overview of what I think about first. How are they eating? Like, how often are they eating? What are they eating? What is diet quality? Are they hydrating? Um, Really, like those first two things answer a piece of the fatigue for most of my patients. Like, what is sleep? Has sleep been impacted? What about exercise? Hands down, over and over, the best intervention for chemotherapy related fatigue is exercise, but really it can just be gentle. I tell people, like, just put on your sneakers and like take a walk around the block. Like, this doesn't mean you have to go to the gym and you're like in the boot camp. Like, even gentle exercise can improve fatigue during chemotherapy. I wanted to include some research, so I kind of gave you some examples and the references as well, just showing that people who exercise had measures like mood and quality of life, and everything just felt better when they did that. And then I list out, I do kind of, I'm gonna kind of go to the bottom of the slide first on this, is that I do check labs too and just make sure that there isn't some nutrient deficiencies causing some fatigue, because sometimes my patients are becoming very anemic from their treatment. And anemia can be from chemo. Sometimes the cancer itself cause anemia, but sometimes nutrient deficiencies like iron or folate or B12 can cause deficiencies that cause anemia. And then the people have tremendous fatigue because they don't have enough blood, and blood is what takes our oxygen around our body. So I do a lot of labs looking for kind of investigating, making sure there's not a metabolic reason for the fatigue. I utilize B vitamins a lot to help with fatigue, depending on the chemo. Carnitine is a nutrient, your body makes it, but your body's carnitine levels go lower when you're on chemo. So sometimes I'll give people exogenous carnitine in a powder or a drink or something like that. But there have been mixed studies on carnitine where lower doses didn't really work so well and higher doses did. So do pay attention to dose on carnitine just in case you're not getting results. And then I want to highlight that mood is a big piece of the fatigue with chemo. A lot of people get a little bit depressed because it's like, going through a serious illness, and all that the treatment entails, and the travel, and the lifestyle, and missing out on things. So when mood is a factor, sometimes I'll use a botanical that has an antidepressant effect that also can help with energy. So I do utilize that as well, when there isn't a drug interaction concern. Then I just want to highlight that there were two big studies that were done, looking at American ginseng since 2010, so some were a little bit later than that. And one of them was exclusively in breast cancer, and they found that fatigue was better in the ginseng users, and that also that there was safety, so that there was an interaction with the cytochrome P450 system. It didn't seem to interfere with a lot of the chemos. So that was good. And the dosing is very interesting on ginseng, where you give it in the morning, but you also give it at lunch. So in those trials where it was effective, sometimes you'll see dosing on like meds being like twice a day. And then I'll talk to a patient and they're like, oh yeah, like I'm taking that like before bed. I'm like, oh no, you're taking like the energy support before bed. So, twice a day dosing on something that is for fatigue, just make sure that it's like in the morning time and then it's also in the afternoon time. But this is something I will sometimes go to the ginseng if I'm not getting results with others, because it has the positive trials. Okay, so we have about a couple more minutes. So let's just talk about immune support too. And of course, this has been a really big thing with, of course, the COVID this year, and a lot of treatments can cause a decrease in white blood cell count. So a lot of my patients are super anxious about immune support. I get emails and voicemails and office visit calls all the time. Help my immune system, boost my immune system. What can I do to do that? So I wanted to highlight some of the things that I do the most often with my breast cancer patients. So zinc is just super essential. There's some interesting work actually being done looking at triple negative breast cancer, that high copper levels are a disadvantage, could increase recurrence and can cause some actually progression. So like there are trials showing that copper chelation may have an anti-tumor effect. So I am checking zinc and copper levels in my triple negative breast cancer patients because of that research that is going on. And a lot of treatments actually cause zinc deficiency, and people will notice it. They'll start getting taste changes, they'll have mouth sores, they'll have poor wound healing. So sometimes I'll check the labs, but other times I can just tell based on symptoms. If my patient's getting platinum chemo, I'm very suspicious. My index of suspicion is very high for zinc deficiency. And this is something very inexpensive, well tolerated, comes in a lot of forms. I love zinc citrate, picolinate, carnosine. So there's different forms for different indications, but that's something that's really high on my list for my breast patients for those reasons that I just mentioned. Vitamin D, I put a lot of studies from the past couple of years just showing that inadequate vitamin D is not good in terms of breast cancer risk and also recurrence. Look how those is very interesting. I want to point this out to you guys is that look how 400 IUs didn't really do much. So people who are taking 400 IUs, which is kind of like your like typical multi, didn't really reduce the risk much. So I would really argue to have your vitamin D level tested and then make recommendations based on that level, because the amount that's kind of in your typical kind of lower multi didn't really have like it had a 3% reduction, but that's just really not much and it didn't reach statistical significance. So pay attention, run labs, make modifications as needed. And I want to just point out that there's people are really paying attention in terms of recurrence, keeping that vitamin D level up, but too much is not a good thing either. Look at this last study on the bottom of the slide. So having low vitamin D, so for most labs that's below 30, but there's different ranges, led to worse outcomes, but having too high, like over 100, 120, wasn't good either. So the people that did the best were kind of like optimized, like in the second, third, fourth quartile. So being too high was not as bad as being too low, but it still wasn't as good as being where you should be. And sometimes I'll have a patient come in and I check their vitamin D and it's like 256, which is like, you know, like 3 times where it should be. So I'm like, hey, like more is not necessarily more. And then I print out the study for them and just like point out that like most things in nature and in the body, there's like an optimal range for sure. And we're almost done. I want to highlight green tea because green tea has a lot of data, population study data looking at reducing recurrence. Both primary prevention, so there's 2 things. There's primary prevention, which is getting breast cancer in the first place, and there's secondary prevention, which is getting recurrence of breast cancer. And green tea seems to do both, but it seems to be maybe even a little bit more solid in terms of reducing recurrence on the meta-analysis. Remember, meta-analysis is taking all the studies and putting them together. And I also wanted green tea in this PowerPoint because there's some interesting studies looking at green tea consumption and less influenza. So that also is relevant coming into cold and flu season. There was a Japanese study of healthcare workers where when they had green tea consumption, they had less influenza regardless of vaccination. So even if they got the flu shot, the people who drank green tea and had the flu shot still got less flu than people who did not drink the green tea. So I'm a big advocate. I work at a hospital myself 2 days a week. I'm drinking green tea there for sure. It's an easy thing as long as you don't mind the taste of it. I don't always recommend green tea supplements, and depending on the situation, depends on drug interactions. Sometimes I do recommend them if someone does not like green tea. I understand that some green tea tastes like the front lawn. My suggestion would be to try different varieties and find one you like because some of them are really delicious. And I myself find some to be kind of grassy and like it's just not going to happen for me either. And you can mix it. Like you don't reduce the benefits of green tea by adding like lemon to it or mixing it with another hibiscus tea. Like that doesn't diminish the benefits of it. And then almost at the end, and I just want to point out there's just so many studies on mushrooms and breast cancer. It's kind of getting like just a mountain of research looking at mushrooms improving something called NK cells, which are natural killer cells. It's a type of T cell that goes after cancer cells, but it actually is really good at going after viruses too, as well. So when I have a patient and they're coming into this cold and flu and they're very worried about, you know, both the breast cancer aspect and there's chemo studies too, showing that maitake and reishi are safe to use alongside chemo, then I'm definitely using either having them eat mushrooms or sometimes taking a mushroom supplement to help them boost that NK activity, especially this time of year. And I just put even more studies in because people ask me too. They'll be like, well, what kinds? And these are the kind of some of the strains, cordyceps, this is turkey tail. So I just want you to shiitake. So I just want you to have some kind of more information. I also put this study in here that showed that if people ate fresh or dried mushrooms, it could also be preventative in terms of breast cancer risk. It didn't have to be just a supplement. So I wanted to give the example of a food too. Okay, so I told you I was going to cover a lot of material in kind of a short period of time. If anyone has any questions, let me know. And if they don't and they think of one later, you can always reach out to me too, and I will get back to you and get you any answers that you might have.
Yes, Dr. Smeckens. We do have a couple of questions from our participants.
Okay.
The first question being, what do you recommend for sleep during treatment? I have heard CBD oil helps. Is there anything you recommend?
Yes. Yes, I do use CBD oil. I do use it. However, I am a little concerned about CBD with some drug interactions. So I typically have people start it like a certain number of half-lives away from, say, for example, they're on chemo, like 2 half-lives away, which would be like 48 hours after chemo. So I use it, but I'm a little conscious about a potential interaction with CBD. But I do use it. I love theanine, which is derived actually from green tea, but not caffeinated, which activates GABA receptors. So it's very calming. So if the sleep issue has to do with anxiety, I love theanine. I love Relora, which is another botanical, again, an anxiety lowering thing. So I love that as well. I love magnesium because so many of these treatments cause magnesium losses. A lot of the treatments do, and people get muscle cramping and constipation, and magnesium has some hot flash studies showing benefits. So I like to use magnesium before bed a lot too, especially if there's some night sweats going on. I tend to use some magnesium before bed as well, for all those reasons.
Okay, great. There is another question. Do you provide a tailored program for your patients?
Yes, of course. Yes. I love working with my patients. I could not say enough how much I love working in oncology, and especially breast oncology. And I love meeting people, hearing their goals, and like what it is that they're hoping to achieve, and helping them so that they can best tolerate treatment. And then, really, if you think about breast cancer, the survivorship period is really long. So, like, after someone goes through definitive treatment, if it's a curative intent situation, sometimes they're getting long-term hormonal treatment for 5 or 10 years. So I like being kind of like, a coach along that way, and helping people, so that they can stay. About almost, some studies say about 50% of people will quit their aromatase inhibitors because of side effects. Well, it's my job to help make that less desirable. It's my job to help make those things more tolerable, so that people can adhere to their treatment. And I love doing that.
Great. Well, thank you. Are there any more questions at this time? Okay. Well, I see that you have your information posted, and if anyone else would like to reach out, they can do so um, by your information being posted. And in closing, this has been really informative. I'd like to thank you, Dr. Smekens, for joining us and speaking today, and our co-sponsor, Cancer Wellness Magazine, as well. Thank you so much.
Thanks so much for having me. Everybody have a wonderful evening, okay?
Thank you.